Kia ora koutou and welcome along. My name is Victoria and I have the distinct privilege of being the nurse support for Bowel Cancer New Zealand. Today I am really thankful to be introducing Professor Frank Frizelle, one of Bowel Cancer New Zealand's medical advisors and an esteemed colorectal surgeon. So thank you, Professor Frizelle, for coming in and spending some time with us.
Well, thank you very much for asking me to.
When people are sitting outside of that kind of screening age, which is 60 to 74 years old, is there something that younger people can do to kind of get themselves screened or tested? Is there ways around that people can look into?
So if you've got symptoms, talk to your GP. And if you get declined from the public hospital, which may well happen, given the focus on the acute admissions and the lack of resources in the public sector, go back to your GP and have another discussion. That they can do fecal occult bloods, they can check your ferritin, they can look at your stool for various things. But also in many communities now, like in Canterbury here, we have the charity hospital, which will do flexible sigmoidoscopy on patients that have been declined from the public sector. And so if you've got symptoms, and discuss it with your GP, and if you're not getting progress with them, think about alternatives outside the public sector. Now, other symptoms that if people just want to be screened and they've got no particular symptoms, again, if you talk to GP, they can do fecal occult blood. There is a rate of false positives, so some of the tests will turn positive, despite there being nothing seriously wrong. And that rate is the same for all ages, so it is no more common in younger people than older people. But what is more common is that the test is usually normal in younger people. And so that is true negatives are more common. So it's a way of just checking it out. Many other countries have lowered the screening age down to 45 and with access from 40, and that really makes a bit of a difference.
Definitely. So ideally, it would be lovely to see New Zealand having a younger screening age. And I know that that's in process. There is the rollout for Māori and Pacifica because they are often much younger and often more advanced when they are kind of diagnosed. So there are some steps coming towards getting that screening age lowered, which is always going to be, good news. May make your life a little bit more busy, Professor.
That's all right. It's not. Being involved in management of patients with bowel cancer is really very rewarding. The hard thing is actually changing the politics around it, getting screening done.
Yes. Look, is there anything else that is important for people to know and be aware of as we're kind of coming into, raising awareness around bowel cancer and things like that? Is there anything else that you think is really important for people to know?
Look, most people try to avoid things to do with poos. It's not a particularly trendy or popular area. What goes on in the bathroom tends to stay in the bathroom. But this is a real killer, and it's a really common killer in New Zealand. And caught early is completely curable. So just a little bit of attention to this, and you could save years of regret from your friends and family and yourself. So do take it seriously. It is a disease which can be caught early and can be cured.
Yeah, and I think that's the very good news story about bowel cancer is the fact that, caught early, it is a very curable, beatable, treatable cancer that's out there with the early screening and early detection.
Yeah, I think you're quite right.